If you've ever been told you have a disc bulge, one of the most important things to understand is this. Not every disc bulge causes pain. Disc bulges are commonly seen on MRI, but not the real question is whether the disc bulge is actually the structure creating your symptoms. A disc bulge happens when the outer portion of the spinal disc begins to extend beyond its normal boundary. The disc sits between the vertebrae and acts like cushions, helping absorb load and allow movement. Over time, or sometimes after a specific injury, that disc can begin to lose its normal structure and start pushing outward. When that happens, symptoms can vary. Some people feel a deep ache in the low back or neck. Some feel pain that gets worse with sitting, bending, lifting, or twisting. Others may notice pain that starts traveling into the hip, leg, shoulder, or arm. And when the disc starts irritating a nearby nerve, that's when symptoms like tingling, numbness, burning, or weakness may begin to show up. That's why evaluation matters. In our office, we are not just looking at an MRI finding and assuming that's the whole story. We're trying to determine whether the disc bulge is actually the pain generator, whether a nerve is involved, and how much of the problem is coming from the disc versus surrounding joints and muscles. Disc bulges usually develop from cumulative mechanical stress over time. That comes from prolonged sitting, repeated bending, poor lifting mechanics, forward flex posture, or repetitive compression through the spine. In other cases, disc injuries can happen after a more sudden event, like lifting something heavy incorrectly, twisting awkwardly, or a sports injury or car accident. Another thing patients often ask is whether a disc bulge is the same as a herniated disc. They're related, but not exactly the same. The disc bulge is typically a broader extension of the disc, while herniation is a more focal. It may involve a tear where disc material pushes farther outward. Both can cause symptoms, but the severity and the location matters. When disc bulges cause pain, it's usually happening in one of two ways. The first is internal disc pressure. That creates a deep aching pain in the spine itself. The second is nerve irritation or compression. If the bulging disc starts to contact a nearby nerve root, symptoms may begin traveling away from the spine and into the extremity. In the low back, that often shows up as pain into the leg. In the neck, it may travel into the arm, shoulder, or hand. Treatment should make some actual mechanism. If the disc involvement is present, one of the most common treatments we use is spinal decompression. The goal is to reduce the pressure within the disc and improve the mechanical environment of the spine. We may use chiropractic adjustments to improve motion in the surrounding joints and reduce mechanical stress around the injured area. If there is a lot of muscle guarding or protective tension, dry needling may also be helpful to reduce muscle tightness and improve mobility. Recovery-based therapies like hydro massage or cupping may also help calm the surrounding tissues. One reason disc-related pain can linger is because the mechanical stress that caused it is still there. If someone keeps sitting the same way, loading the spine the same way, and never changes the movement patterns that keep compressing the disc, symptoms often continue to keep coming back. If you've been told you have a disc bulge, or you suspect a disc may be involved because of radiating pain, numbness, tingling, or pain that worsens with sitting and bending, it's important to have it evaluated properly. If you're in Olathe and dealing with disc-related pain, our goal is to determine whether the disc is truly the source of the symptoms and guide the right treatment based on your specific condition. Thank you.